Brain fog can be annoying, but sometimes it's a warning light. The hard part is knowing when it's normal overload and when it's something you shouldn't wait on. If your thinking feels suddenly different, or the fog is getting worse instead of better, that pattern matters. A key red flag is change, especially rapid change. Another is impact, when the fog starts interfering with work, driving, or basic daily tasks. And the third is company, brain fog that shows up with other symptoms like weakness, severe headache, or confusion. This isn't about panic. It's about noticing the signals your body uses to ask for help. In this guide, you'll get a clear checklist of red flags, plus a practical way to describe your symptoms to a clinician. You'll also hear what tends to be less urgent, so you can worry less when it's appropriate. Think of this as a sorting tool. What can you watch? What should you schedule? And what should be checked urgently? Moving to slide 2. First, let's define brain fog in plain terms. It usually means slower thinking, trouble focusing, forgetfulness, and feeling mentally cloudy. It's a symptom, not a diagnosis. That's important because many different issues can create the same foggy feeling. Sleep debt, stress, dehydration, and skipping meals can all do it. So can infections, thyroid problems, anemia, vitamin deficiencies, medication side effects, migraines, concussion, and mood disorders. The goal isn't to self-diagnose from a list. The goal is to spot patterns that suggest your brain is being affected in a more serious way. A useful question is this fog predictable and tied to lifestyle factors, or is it new, unexplained, and escalating? Another question is it only attention and memory, or are there changes in language, balance, vision, or behavior? Those extra domains, speech, movement, sensation, are where red flags often live. Moving to slide 3. Red flag number 1 is sudden onset. If you can point to a specific hour or day when your thinking changed dramatically, that's different from gradual burnout. Sudden brain fog can show up with a stroke, a transient ischemic attack, sometimes called a mini-stroke, seizure activity, severe migraine, low blood sugar, or an acute infection. You might notice confusion, trouble finding words, or feeling not yourself in a sharp, unfamiliar way. Another clue is if other people notice before you do. If someone says you're repeating yourself, acting oddly, or you seem disoriented, take that seriously. Sudden onset also matters after a head injury, even if it seems minor at first. If the fog is paired with severe headache, weakness on one side, facial droop, new vision changes, or trouble speaking, that's not a wait-and-see situation. The speed of change is the message. Moving to slide 4. Red flag number 2 is brain fog with neurological symptoms. Neurological just means signs that the nervous system is involved. Movement, sensation, speech, vision, or coordination. Examples include new weakness, numbness, tingling on one side, trouble walking, new clumsiness, or a sudden change in balance. Vision red flags include double vision, loss of vision, or a curtain-like shadow. Speech red flags include slurred speech, trouble understanding words, or suddenly not being able to name common objects. Another big one is a new severe headache, especially if it peaks quickly or feels unlike your usual headaches. Brain fog alone can be benign. Brain fog plus these signs deserves prompt medical attention because it can signal conditions that move quickly. If you're unsure, describe exactly what changed, what you can't do now that you could do last week. That functional comparison helps clinicians triage urgency. Moving to slide 5. Red flag number 3 is altered mental status. That's a clinical phrase, but it can be simple. You're unusually confused, disoriented, or not tracking reality the way you normally do. You might not know where you are, what day it is, or you might have trouble following basic steps. Family might say you seem out of it. This can happen with severe infections, very high or very low blood sugar, medication reactions, intoxication from substances, or problems with oxygen levels. It can also happen with seizures, including subtle ones that look like staring spells. Another warning sign is extreme sleepiness you can't fight, or being hard to wake. If brain fog crosses into confusion, that's not the same category as being distracted. It's a safety issue. The right move is to seek urgent medical evaluation, especially if it's new, escalating, or paired with fever, stiff neck, chest symptoms, or severe headache. Moving to slide 6. Red flag number 4 is fever or a stiff neck with brain fog. Not every fever is dangerous, but fever plus mental changes can signal your body is fighting something that affects the brain or its lining. If you also have a severe headache, light sensitivity, rash, or you feel rapidly worse, that combination deserves urgent attention. Another related pattern is brain fog after a recent infection that doesn't resolve, or that returns with new intensity. Some infections can trigger inflammation, dehydration, or electrolyte problems that affect thinking. Even without a high fever, chills, sweating, or a racing heart can be clues that your system is under stress. The key is the pairing, brain fog plus systemic illness signs. When you talk to a clinician, mention your highest measured temperature, how you took it, and whether you can keep fluids down. Those details help separate watch at home from needs evaluation. Moving to slide 7. Red flag number 5 is brain fog with chest symptoms or shortness of breath. If your brain feels cloudy because your body isn't getting enough oxygen, that can become serious quickly. Watch for new or worsening breathlessness, chest pressure, a racing or irregular heartbeat, or feeling faint. Sometimes people describe it as, "I can't think clearly when I stand up," or "my head feels floaty and I'm winded." That can relate to anemia, heart rhythm issues, lung problems, blood clots, severe asthma, or other conditions that reduce oxygen delivery. It can also happen with dehydration and low blood pressure, but you don't want to assume. If brain fog is paired with blue or grey lips, severe weakness, or you can't speak full sentences without gasping, that's urgent. Even milder symptoms deserve prompt evaluation if they're new or escalating. Your brain is sensitive to oxygen changes. Moving to slide 8. Red flag number 6 is brain fog that follows a head hit or whiplash. Concussions don't always look dramatic. You might not pass out, you might even feel mostly fine at first. Then the fog shows up. Slower thinking, headaches, nausea, light sensitivity, irritability, or trouble sleeping. What makes it more concerning is worsening symptoms, repeated vomiting, increasing headache, new weakness or numbness, or behavior changes that are out of character. Another risk factor is being on blood thinners or having a bleeding disorder, because internal bleeding can be harder to spot. If you had a fall, sports collision, car accident, or even a hard bump, and your cognition is off afterward, it's worth medical evaluation. The key message is simple. After head trauma, don't treat brain fog as just stress. Treat it as information about your brain's recovery. Moving to slide 9. Red flag number 7 is a progressive decline over weeks to months. This is the opposite of sudden onset, but it can be just as important. If your memory, focus, or word finding is slowly getting worse, and it's not explained by a temporary stressor, it's worth a medical workup. You might notice you're rereading the same paragraph, missing appointments, or struggling with tasks that used to be automatic. Another clue is personality or motivation changes, becoming unusually apathetic, irritable, or impulsive. Progressive brain fog can be linked to sleep disorders like sleep apnea, thyroid disease, vitamin B12 deficiency, anemia, chronic infections, autoimmune conditions, depression, and medication effects. It can also be an early sign of neurodegenerative disease, especially with strong functional impact. The goal of seeing a clinician is to look for reversible contributors and to document a baseline. Earlier evaluation often gives more options for support. Moving to slide 10. Red flag number 8 is brain fog with significant mood or behavior shifts that are new for you. Stress and low mood can absolutely affect concentration, but there's a line where the change becomes clinically important. Watch for severe anxiety that feels physically overwhelming, panic with confusion, or depression with inability to function. Also watch for agitation, paranoia, hallucinations, or a sense of being disconnected from reality. Those symptoms can be linked to sleep deprivation, substance withdrawal, medication side effects, thyroid problems, and other medical issues. It can also signal a primary mental health crisis which still deserves medical attention. Another clue is sleep disruption that's extreme, going days with very little sleep, or sleeping far more than usual and still feeling mentally off. The goal here is safety and support, not labels. If your behavior changes are scaring you or the people around you, it's time to get help promptly. Moving to slide 11. Red flag number 9 is brain fog with unexplained weight change, heat or cold intolerance, hair changes, or bowel changes. That cluster points toward hormonal or metabolic issues, especially thyroid problems. Hypothyroidism can make you feel slow, forgetful, and mentally heavy. Hyperthyroidism can cause racing thoughts, anxiety, and poor focus. Another common contributor is anemia, which can cause fatigue, shortness of breath on exertion, and cognitive dullness. Blood sugar swings can also create fog, especially if you get shaky, sweaty, or irritable when you haven't eaten. None of this can be confirmed without testing, but these body-wide clues help prioritize a medical check. If your brain fog is paired with persistent fatigue that doesn't improve with rest, it's worth asking about basic labs. The point is not to chase rare diagnoses, it's to rule out common, fixable issues that can mimic just stress. Moving to slide 12. Red flag number 10 is medication or supplement timing that matches the fog. Many people don't realize how often brain fog is a side effect. Sedating antihistamines, some sleep aids, certain pain medications, muscle relaxants, and some anti-anxiety medications can all slow thinking. Some medications can also affect blood pressure, sodium levels, or alertness. Even natural supplements can interact with prescriptions or cause unexpected effects. A big clue is timing. The fog starts after a new medication, after a dose increase, or at a predictable time after taking it. Another clue is that the fog improves when the medication wears off. The safe move is not to stop anything abruptly on your own, but to document the pattern and discuss it with a clinician or pharmacist. Bring an accurate list, including doses and how often you take them. That one step can save a lot of guesswork. Moving to slide 13. Now let's talk about what's often less urgent, so you can calibrate. Brain fog that tracks clearly with poor sleep, intense work stress, dehydration, or skipping meals is common. It's still real, and it still deserves attention, but it's usually not an emergency if it improves with rest, food, and hydration. Another reassuring sign is stability. Your fog is annoying, but not progressing, and you don't have neurological symptoms like weakness, slurred speech, or severe headache. Also, if you can still do your normal tasks safely, even if they take more effort, that's a different risk level than being confused or unsafe to drive. The key is the trend line. If you make basic changes and the fog consistently lifts, that points toward lifestyle drivers. If it doesn't lift, or it keeps coming back in a stronger way, that's when you move from self-care to scheduling a medical visit. Moving to slide 14. If you do decide to see a clinician, you'll get better answers with a tighter story. Use 4 anchors: onset, pattern, impact, and associated symptoms. Onset means when it started, and whether it was sudden or gradual. Pattern means constant versus episodic, and what makes it better or worse. Sleep, meals, stress, exercise, menstruation, infections, or medication timing. Impact means what you can't do reliably now, like reading, driving, managing finances, or remembering conversations. Associated symptoms are everything that travels with the fog: headaches, dizziness, palpitations, fever, numbness, mood changes, or sleep problems. If you can, track a simple 7-day log with sleep hours, meals, hydration, and symptom severity from 1 to 10. Also bring a full medication and supplement list. This turns a vague complaint into actionable information, and it helps clinicians choose appropriate exams and tests. Moving to slide 15, let's wrap this into a simple decision rule you can remember. If brain fog is sudden, severe, or clearly different from your baseline, treat it as urgent. If it comes with neurological symptoms, weakness, speech trouble, vision changes, balance problems, or with confusion and disorientation, that's also urgent. If it's paired with fever and a rapidly worsening illness, or with chest symptoms and shortness of breath, don't ignore it. If it follows a head injury and worsens, get evaluated. And if it's slowly progressing over time, schedule a medical visit to look for common contributors and establish a baseline. Your goal isn't to diagnose yourself. Your goal is to respond to patterns that carry higher risk. One practical step is to write down your top 3 symptoms and your top 3 triggers, because that alone clarifies the picture. If you want, share in the comments, is your brain fog more like A, sudden and scary, or B, gradual and persistent? And if this checklist helped you sort the signals, consider subscribing for more clear, evidence-based health explainers. This information is not a substitute for medical advice. Peak performance begins with optimized biology.